sit to address the House for 1 minute. Stand and revise my remarks.
Without objection.
Thank you, Mr. Speaker. There's no one on our side of the aisle that would argue that we have necessary reforms for this medical health care system that we all enjoy and we're mostly all alive because of. The comments to the contrary, that this is totally broke and totally unworkable, as you know, are hyperbole, simply done to try to incent a riot, I suspect. 4.7 million jobs are estimated to be lost with this health care plan. That's a big number, but 4 or 5 of those jobs are at our long-term health care plan company in Atlanta, Texas. Stephen Lang sent me an email that says if he's required to put this 8% tax on his business, because it's a low-margin business, because he gets Medicare reimbursement for 90% of his revenues, he will be unable to pass that 8% increase in the cost of doing business along to his major customer, i.e. the federal taxpayer. Because of that, he will have to cut his employee base. His employees take care of the most vulnerable, frail, and least capable people in our society, folks at the end of life. And cutting the service to them should be not something that we ought to do. The physicians in the group say, do no harm. First, do no harm. I would argue that this health care plan ought to be the same thing. First, do no harm.
Time has expired. For what purpose?